Portage County Board of Supervisors meeting, recorded September 15, 2020.
It's 5 o'clock. We'll call the Portage County Board to order. Roll call.
We have 17 supervisors attending in person, 5 attending remotely, and we have 3 excused supervisors, Hanel, Reeser, and Zastro. Reeser is on remote, never mind. All 25 accounted for.
Very good. Pledge allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Invocation by Supervisor Hanel. Joan is not with us tonight. Something came up at the last minute. So I am going to step in. I wanted to make everybody aware that September is Suicide Prevention Month. According to the CDC, nearly 45,000 Americans die of suicide each year. By bringing awareness and engaging in the open conversation about mental health struggles, we can be a part of the solution. Seek out professional help if you or someone you know shows the following warning signs: feeling trapped or burdened to others, giving away prized possessions, withdrawing or feeling isolated, sleeping too little or too much, increased drug or alcohol use, and extreme mood changes. So if anybody knows of anybody, I lost a high school friend to suicide at a young age. And I had actually seen him about a week before that, and he did seem overly chatty. Had I known then what I knew a week later, I would have liked to have the opportunity to talk to him and try and help him figure out some solutions or find a better course. So with that, that's all I have. Thank you. Review and approval of August 18th, 2020 County Board minutes. Moved by Dubek, seconded by Supervisor Robbie. Any other discussion, corrections, or changes? Supervisor Matt Chakowski.
Mr. Chair, I'd like to abstain from voting on this because I was not here at this meeting.
Okay. Supervisor Barry Chakowski.
Me as well, same reason, Mr. Chair.
We have 2 abstentions. Any other corrections or changes? All those in favor with aye? Aye.
Aye.
Opposed? Minutes are approved. Correspondence.
Chair Haga, County Board of Supervisors Code of Conduct Draft. Chair Haga, upcoming County Board meeting dates. ADRC Director Petrowski 2019 ADRC Annual Report, and Cindy is on for questions, I believe, on WebEx. And then County Executive Hallman Diversity Committee appointment.
And the reason the code of conduct, I wanted to get that out there so everybody had the opportunity to start taking a look at it. Some of the committees have put it on their agenda. We've had some feedback and discussion in HR. I don't know if there was anybody else that's had it or seen it yet, but if you could, it's an opportunity for you folks to talk and send me some emails, things that you've pointed out. There's been some good discussion already, so stay tuned. Presentation, Johnson Controls, and it's from me. Just wanted to give everybody an update to let you know where we're at. I was at a Wisconsin Counties Association Board of Directors meeting, and they talked about how they were partnering with Johnson Controls, who is a very large player in air filtration, and I asked them if someone would come and meet with our facilities and talk about what we can do here in Portage County, and talked with Todd to make sure that he was okay, because I was kind of playing in Todd's sandbox and I wanted to make sure that he had time. And I want to thank Todd for making time. He's got a very busy man, but at the same time, he accommodated these folks. Chris, myself, Todd, and 4 people from Johnson Controls were here last week. They toured the buildings with Todd, and they made it through almost all of them. They were in the basement in the boiler room at the healthcare center. They didn't want to go upstairs because of what was going on at this time. And they are working on getting information back from Todd on utility bills, blueprints, room sizes, number of people in the areas. Some of the things they're looking at is where they can put HEPA filters in rooms, where they can take out a 2x4 light fixture. It has a light fixture in it, but it has filtration that has a HEPA filter in it. It has charcoal in it as well to get rid of odors, and then it has either a black light or an ionizer to kill germs. Whether it's to kill germs for the COVID or cold and flu season, these things are always ongoing. They looked at this building. They talked about replacing the whole HVAC system. We have several units and putting one large unit on there. And the thing that I found interesting was they talked about the ionizer or the ultraviolet lights would be on the return lines, not on the exit lines. And as Todd explained it to me, it was because it's purifying the air before it goes into the coils. When it sits in the coils, and that's where there's moist air and there's chance to grow. It keeps the coils cleaner. So these are all things that we're looking forward to getting some response. But I wanted to let everybody know there's a lot of things out there. There's doorways you can walk through that have UV lights to sanitize. There are small pedestals that can check your temperature within 3 seconds and give you either a red or green light and let you go. So there are UV lights that can just be cut in the tile and then shine down on an area where, let's say in front of the treasurer's office where the public congregates, and it's always sanitizing that area because it's killing the germs on the surface, or the information in the county clerks. So stay tuned. We're trying to get some of this done for the deadline to see if there's any funding or grants, whether it's through CARES, and I don't know what is eligible, and I can't remember what entity it was announced that there was $1 billion that was that WIDA? I can't think what it was, but it was $5 billion for skilled nursing homes that have a rating of 4 or 5 stars, which we do, and plus a $2,500 per bed funding towards it. So that's something that we're looking at. And again, if it's not just for COVID, it's cold and flu season. And if we can make these environments much better, both in the juries and in the nursing homes for all of our workers, we're going to see a lot of benefits and call-ins and things with cold and flu, and you can actually have better air at work than you probably will at home. So stay tuned, but I wanted to make sure everybody knew that we were working on something here at the county to try and find some relief. So stay tuned. And yes, we've got UW Extension, Jason Hauser, 2019 UW Extension Annual Report.
Good evening, everybody. Thank you, Mr. Chairman, Executive Holman, and members of the Portage County Board of Supervisors. My name is Jason Hausler. I serve as the Area Director here for Portage County Extension. I wanted to take a few moments this evening, thanks to the Ag and Extension Committee for their support and saying, hey, you should bring the stuff to the board. They need to see it. So we've been presenting to the board here for the past couple of years, just on an annual update. So you should have a physical copy of our annual report. I see some of those are floating around. It was also in your digital packet. So I will try and keep my remarks brief this evening. I have a kind of a quick presentation to walk through this evening. And if there's time, and if it's okay with the chairman, I'll entertain any questions. So for those of you that aren't familiar with UW Extension or the Division of Extension with UW-Madison, we are a partnership between the county and the University of Wisconsin system. So UW-Madison Division of Extension is rather new. in its form and fashion right now. So our colors are now red. We used to be blue and black, and there were some other iterations. So through the transition, Extension is over 100 years old. The first county educator was in Oneida County, and it's been morphing and shaping over time, but it's really here to serve the people and the residents of the communities where they live, where they work, where they recreate, bringing the research of the university out to the people. So we embody the Wisconsin idea. Many of you have having the UW-Stevens Point here know about extending the university research to the people. So we embody that from our flagship school, UW-Madison. When UW-Stevens Point took over the 2-year campuses in Wood County and also in Marathon County, Extension was part of that administrative function. And it was July of last year, 2019, where we had our official move administratively to UW-Madison. So it's been a great partnership, and I'll walk through some of the highlights, kind of the payback to the county for the return on your investment, for your support for tax dollars that come in here for Portage County. So you have the 2019 annual report. I will tell you that 2020 goes without saying, it's been unique and challenging. It's provided us some opportunities for growth and development on how we're delivering our services, because we have still been delivering high quality services during the whole quarantine and pandemic, and continue to reach new audiences through our programming in light of the digital communication era that we're seeing right now. But we're going to focus briefly on 2019. We like to have this done in the first quarter, but when first quarter was nearing the completion, we were in quarantine, and our focus shifted. So I want to get into the agriculture highlights coming up there. So many of you may know of Ken Schrader, who's our ag educator. And please know that I'm here representing the team tonight. Ken's on vacation, so he couldn't be here anyway. So I'm here representing the team. And so a couple of the highlights for them: the producer-led watershed groups brings in some debt cap dollars to leverage that, nearly $40,000 coming into Portage County to support the works of the farmers of Mill Creek and also the Tomorrow Rivers. He's a leader in the organization when it comes to nitrates and how application rates for nitrogen research for corn and hops. So hops is a emerging field, an emerging market here in Wisconsin. So he's actively involved in that, doing some research trials. He's also involved with our Master Gardener program. So we leverage, around 40 Master Gardeners to get out there and help the community out to beautify the cities, the towns, and the municipal centers. So he actually recruits and manages and spearheads that volunteer group, and he's highly involved. And I know our highway department would talk highly of Ken and his work on the wild parsnip and a lot of invasives. John Aaron being the weed commissioner, on all the work that goes with the invasive wild parsnip and its physical health effects that goes with that. So Ken has done a lot of education here in Portage County and around the region on wild parsnip, a true asset to Portage County. Then we get into community development. Some of you, actually many of you, know of Nathan Sandwick, who's our community development educator, highly involved with a lot of state teams, but a lot of local things as it relates to organizational development, strategic planning, and visioning. More recently, the Healthcare Center Committee, he helped that group go through some planning processes and bring in the university research on best practice to the community. Community vitality and placemaking. We know that part of economic development and I guess just development in a community in general is, do residents find a sense of place? Do they belong? And Nathan is a huge advocate of this, and actually steering a statewide team about this, is how do we retain qualified individuals, attentive individuals that want to live, and even so that, hypothetically college students that want to stay here and raise their families here. He's heavily involved in that. So Soul Smart Training and Education. Soul Smart is a designation that promotes that your community is solar ready. Which with that designation, actually Wood County just received it this last year. And it's brought in some grant dollars to offset the cost to the taxpayers of, heating a building such as this or other recreational facilities. And so he's worked hard on educating people about this designation and getting more kind of the energy efficiencies brought to the county and into the community, and not just the county government, but other people in the community. So Nathan's been highly involved in that, and it continues that in 2020. Our human development and relationships educator, Sherry Daniels. Many of you maybe know this as the Family Living Program. working with our home and community education program. But she is really, I see that Cindy from ADRC, her annual report was in part of the correspondence. She's been working on the Strong Bodies program with ADRC, a great partnership that they have to get, it used to be called Strong Women's, and now it's Strong Bodies, because we know that, as you age, being physically active is not it's not something you continue to do on a daily basis, but this gets people up and moving and some light involvement. And we have sites throughout the county, Amherst, Rothschild, you name it, there's probably a site there. And actually it's one online, so there's a lot of people that are still engaging with that program online. Financial wellness, working with individuals, especially in this tough economic time, about how they manage their budgets. And there's a Rent Ready program that's out there right now, working with UW Stevens Point to make sure that when people rent a property, they are financially sound and they're making good decisions and they're a good renter. It's part of that whole financial wellness piece. And starting them early, so Dollars During Development is a great program that she's been working on. So some other quick highlights we get through FoodWise. FoodWise is a 100% state/federally funded program. There's no county dollars that go into this program. We are fortunate to have 2 staff members in our FoodWise program. This is the SNAP program. So the SNAP ed dollars that come to the state are administered through extension. And so as you can see, there's nearly 400 direct individual contacts, both within the school setting, within your food shelves, and also the kids in the kitchen. So you see that there's a picture of Penny doing some things with young people. They focus on my plate and making good sound decisions when it comes to food and nutrition. We also had some new staff in this area, so we're kind of in this influx a little bit, but that was in 2019, and we have a stronghold now moving forward with that program. But again, it's no county dollars are in this program. By having your office open, you receive the benefits of the FoodWise program just by maintaining a presence here. So last but not least, we get into one of our foundational programs, 4-H and Youth Development, and Connie's work. So it is by far statewide, 4-H and Youth Development is the largest program, kind of a flagship program of extension. So as you get through the annual report, you talk about all the camp programming that she does, all the youth garden programming. It's developing young people and promoting life skill development through hands-on application with 4-H projects, with community service events, youth leadership, you name it. So the program is very vibrant here in Portage County. Per capita, it's still at the upper echelon of per capita. So 350 members with 13 clubs. Neighboring counties, I shouldn't say the clubs are dwindling. Membership is still status quo. But we're fortunate enough that there's 13 clubs and near over 100 adult volunteers. So with that said, I want to, those are the highlights here for Portage County. A couple of things before I conclude this evening. Again, I wanted to keep my remarks short. Is we in Extension, we leverage a statewide network. There's an Extension office in 71 out of 72 counties in the state. So if there's not an educator in our office that can handle our code request that comes in, we leverage the network. So an example of this is when Nathan comes in and says, hey, I know that government right now and voting and voter registration and that sort of thing is a huge thing that is happening within our communities and people need that. He doesn't have expertise in that area. We have a local government center within Extension that he can leverage. So Daniel Foth and the folks down in Madison will come up here and actually there's actually some workshops that actually Executive Holman and I were going back and forth on through our local government center. We can leverage those resources here in Portage County because of your investment. One of the things that I know is also happening recently is water quality is a huge thing. And so working with Wood County, they are working on a program right now. And I know Portage County passed the same resolution to ask UW-Madison to do more research on nutrient management plans and looking at application rates and those sort of things. And the state has listened to that and actually hired a specialist to help our ag educators around the state to really work on this and water quality. So that was, the year of water in 2019. We're taking that to heart as Extension and bringing it out to the people. So just know that there's a statewide network. And if we don't have the resources here to address the question, we leverage the network and we're happy to do that for you. So As we get into extension funding, I think it's always budget season, and people like to know, well, tell us about the return on investment. So as you can see there, our rough all-in cost for 2019 was nearly $700,000, and that's for all of our staff, both state and local staff, and all the supplies. So it's broken down, and when it says state allocation, that's state and federal dollars that we leverage. There are Smith-Lever dollars from the federal government that comes down. So it's roughly a 60-40 split. As you look through, I believe the percentages are up there yet, of funding when it comes in. So your investment of $283,000 annually to our office is leveraged 1-to-1 plus from state and federal dollars that come in. So we are contracted services through an educational fee base. So every educator, you don't pay the real cost of what their salary infringes. You pay a fraction of that fee for service for those educators. So again, when you get to the state food-wise salary infringes there, I think it's important that we're transparent with our numbers. So this is as best the numbers as I could find with the data that was available to me at the time that it pulled us, which was about a month ago. So, and that does not include any of the state specialists. So we also, speaking of water quality, some of you know Kevin Massarek at Stevens Point. He has an extension appointment, so he works for extension. And so when he comes in and does presentations and all sorts of things, we don't charge for that, and that's not included in this fee. So I think it's important that we talk about our funding and our funding streams. In case you have questions on that, I'd be able to ask or answer more of those. And then last, we get into leveraged funding. So it's not just the cash flow, but what do we really, leverage in our community for the betterment of all. So our 4-H volunteers, our Master Gardener volunteers, really put a lot of time and energy into our program. If it wasn't for them volunteering, we wouldn't be able to execute half the programming that we do. I mean, in all honesty, we really do rely on those volunteers. So it's hard to put a dollar on volunteer hours, but the independent sector is a highly sought after organization that does put a dollar value on there. And in your county report, I think county used the figure of $25. I pulled the recent one, it's actually $27. And so if we look at a modest allocation of 5 hours a month at the $27 an hour, we leverage nearly $250,000 just in volunteer hours back to the community through our programming. Master Gardener work, 4-H volunteer work, youth work. I think that's a modest amount, and some volunteers will tell you it's more than 5 hours a month. It's 10 to 15 hours or double or triple that. So again, I think it's important that we understand that, again, the dollars that you're putting into extension, the services that you get here are leveraged both from state and federal dollars as well as in-kind donations, so through volunteerism. So that's what I have for this evening. I want to thank you for your time, and if the chairman will allow, I'll entertain questions.
Yep. Any questions for Jason? Mr. Holman.
Thank you, Mr. Chair. I just had a quick question on the funding aspect, and I asked the regional dean last year, just because the ag economy being what it is, you heard Jason reference the Smith-Lever Act, and one of the metrics for that funding is the number of farms in the state. And so I'm just curious, I know you don't have those numbers, and I'm just wondering if people are talking about that sort of thing at the state level, especially with the upcoming biennial budget from the state as well, because I know it's not a huge portion of the funding, but given some of the challenges on the horizon, I'm just curious if there are conversations happening and what they sound like at this point. And then also just a note to say that if challenges start to arise from those sorts of things, that just be sure you leverage us, because, it's clear that you're a good investment to the community, and being able to support you guys and make arguments on your behalf would be important.
Thank you. Great question, Executive Holman. Yeah, I can't quantify the numbers, and you're exactly right, the number of farms. And I do know that there's conversations about defining farms differently. The traditional metrics of what constitutes a farm have been up for discussion, not just in the state, but also on the federal aspect of things. So I don't think they've determined what that final definition is, but it's a good question and something that we continue to monitor. I will tell you that our funding from both our state partners and our federal partners, they keep telling us in light of the pandemic and managing that is holding steady, no changes right now. The state has actually pulled back some of our some of our allocations over the last couple of months to make up for the shortfalls. However, we are great fiscal stewards, and so we've held positions open, not quick to refill. So really being budget conscious is what we do. So as of right now, I think things are holding steady, and we're managing that internally. So I appreciate the executive bringing that up. We're constantly monitoring that, and something that our dean and director and the provost are highly involved in.
Supervisor Gifford.
Yeah, I just wanted to remark on how great I found the staff to be. Besides working with Ken Schrader and when I was in the Land Conservation Committee, the fantastic work that he's been able to do with John, and getting so many school kids involved from age 6 on up is just pretty amazing. But also, I worked with Sherry and Denise in the Hunger and Poverty Prevention Partnership and found them to be just like, they have their finger on the pulse, at all times, as well as Nathan. I was involved in something he did called Making Ends Meet, and then he was also involved in the Community Change Project. And those are things that focus on our low-income people and the struggles they're going through. So they're like top-notch staff and good resources, and I'm glad we have them we can talk to when we need to.
Yeah. Thank you, Supervisor Gifford. I appreciate those comments, and I would say that you touched on a couple of things, if I may. Things aren't even in the packet, aren't even in the report. So I asked the staff, I said, give me 3 to 5 things from 2019. But as you mentioned, there's way more than what's actually in here. And I invite you to connect with our educators, call them up, you drop them an email, whatever's comfortable for you, to really, get to know them. And again, I'm here representing them tonight, but they're always available to all of you at any time. So myself included, but yes, thank you for those comments.
And I was glad to see that the Rent Ready program, it wasn't in the brochure, but I was glad to see you touched on it. That was something that we've had presentations on as well. So. Anybody else have anything? Any comments? No? Supervisor Barry Jakowski.
Thank you, Mr. Chair. I would just like to thank Jason. He took over at a time when Extension and became our area director when Extension was going through some growing pains. And of course, didn't know Jason from a slice of bread when he first walked in the door, but he's done a fantastic job as an area director and has kept a very, very capable staff on track as we went through those growing pains. And I have been, in my tenure here on the Portage County Board of Supervisors, I've been a member of the Ag and Extension Committee that whole tenure. And I would like to invite anyone who hasn't had the opportunity to be involved with the Ag and Extension Committee and or the things that both our educators and staff do. Take time to come to a meeting that Nathan Sandwick has facilitated. Take a farm tour out at John Aaron's that Ken Schrader has helped coordinate, or the farm tours for the Tomorrow River groups. We have nitrate problems in our water here in Portage County. Ken realized that a long, long time ago, has been doing just tremendous work on nitrogen applications on the crops that are grown here in Portage County. So I do, as a member of that board or committee for a long time, I invite you to maybe take a tour or get involved or sit in on one of Sherry Daniels' Strong Bodies thing. They're just a realm of things, and I've always been so fascinated as the amount of things they get done with the dollars that we have here in Portage County. So I thank both Jason and the staff highly. So
thank you.
Thank you.
All right. With that, thank you, sir.
Thank you very much.
Next item, Health and Human Service Director Ray Shabilsky and County Executive Holman, COVID-19 update.
Good evening. Good to see you all again. I hope this stops sometime soon, but I don't anticipate that. So the update of where we're at, as you've probably heard, our numbers have been going up. Yesterday, we had 949 cases. Before I left today, I know we were at 988. So we went up 39 cases today so far. Out of that 949, 750 have been recovered. That's about 79%. That percentage is lower. But when we're starting to get 30, 40, 50 positive cases a day, and it takes 30 days to reach that recovery status, a percentage of recovered cases is going to drop. It's also going to go up rather sharply if this ever levels off, because then at the same time, you're going to get 50 cases a day moving into the recovered status, hopefully. So that's where we're at. The bottom line is that right now, we're overwhelmed. We're overwhelmed and we're drowning. We have 11 FTE contact tracers that we have hired. So that's about, I think that's 16 bodies actually, because obviously some are part-time. Our goal here is that, and we believe that we need to get up to 15 FTE contact tracers. So we need 15 full-time equivalent contact tracers on board in order to try to manage what we are currently receiving on a daily basis. Our biggest need with contact tracers right now is weekend coverage. We run 7 days a week, 8+ hour shifts. That's what we're doing. So we're not a 24/7 operation, but we're a 7-day-a-week operation. And if our operational period is at least 8 hours, we need people to cover that. So, we've had a challenge trying to find, enough contract tracers on the weekend, specifically so I can reduce the number of my nursing staff that needs to be available. Because right now I have 8 nurses. 4 or 5 of those nurses are working every Friday, every Saturday and Sunday. So I would like to try to get my contact tracing numbers up to where I could possibly only have 2 nurses working on a Saturday and a Sunday. That way they're rotating on a much more infrequent basis. I guess they didn't like me talking about my nurses, but they, and that's just going to help us with just the stress that we're involved. People have asked, what happened? Why the big increase in cases? And it certainly is related somewhat to the fact that the UWSP came back. We're getting a lot of positive cases from UWSP. It's also been related though to just things going on here in the county. People are being social. We've had outbreaks related to weddings, funerals, baby showers, barbecues, just people getting together, and people are actually looking at this, and now they're kind of referring to this as COVID fatigue. That people are just they're so longing to get back to what they feel is normal. They don't want to wait any longer, so they're doing these things. And unfortunately, what we're seeing is just how contagious this virus is, and how it can spread. Since the last time I was here, unfortunately, we are up to 3 deaths here in Portage County related to COVID-19. I don't think the last time I was here we had any, maybe 1, if I remember correctly, but we're up to 3. So, we don't like to use the fatality as a measuring stick, but it's a fact. It's a fact that it's out there. So we're busy. We're doing the best that we can to try and manage this. There's just lots of things going on, lots of moving parts going on, but all the kudos to my staff, to Gary and all my public health staff, for what they're doing. We're rolling up our sleeves, coming to work every day and just doing the best that we can. So any questions so far?
Barry? Thank you, Mr. Chair, and thank you for the update, Ray. I'm quite certain that we here in Portage County have been lucky that we didn't have the outbreaks that we had in some of the other states and some of the other cities around the Midwest. And my question is, from what I've read on it, they feel that our death tolls maybe are going down because we've learned that there are some therapeutics and some therapy treatments that are helping more than we had realized, or have learned the therapies that have helped from experiences as we've gone through this. Do you see that, or have you heard that there are therapies that are working better than or we found therapies that work that we didn't know about early on?
We have not heard that, Barry. Is that a possibility? Absolutely. That's absolutely a possibility. I think part of it in regards to, the fatality rate is I just think that we have people in our community that are very aware of what's going on. I think they're getting to medical help. And I think that the capacity that we've had with our medical systems has been really good. Again, there's no specific treatment for this that we know of, but yet for those people that require hospitalization, I think our systems are still at a good point, and I'll tell you that today, that they're still at a good point for capacity. We measure this across our northern region, our northern HERC region, but we're just fortunate in that people are being able to access that. But what you're saying could absolutely be true. So.
Ray, you touched a little bit on the hospitalization, and you'd said that we're at a good point. Can you talk a little bit about how many beds we have in this area, and do you know roughly?
Off the top of my head, Al, I wouldn't want to give you the wrong answer, but I certainly can get back to you on that. So.
I just wanted to make sure that, one of the first things when they started out with this, when they had the stay-at-home order, and then again with the mask, was they tried to slow the COVID down so that we don't overwhelm the hospitals and the medical staff. And I just wanted to make sure that even though these numbers are showing an increase, that we're still okay at the hospital end of it as far as having capacity there.
Well, and I think that, I know that our biggest hospital partner in our community is the Ascension. They're our biggest hospital partner. Obviously, Aspirus also has some hospital beds here in our community, as well as up in Wausau, as well as Marshfield Clinic. The bed capacity is strained greater today than it was a month ago. I will tell you that. They still have capacity. There's not a concern with PPE, which was also a big concern at the beginning of this, was that there was just a PPE shortage. So there's not, all of our systems feel like they have a 7-day supply that, if they never received another thing, they were good for 7 days, but they continue to replenish their PPE supply. So there are beds available. We know that more beds are being utilized today. But I think our systems are doing the best that they can to try to manage the people that are coming into their system.
Just like,
where are these tests being done? I don't see the drive-through testing. So if you could touch and elaborate on that, have the test kits come through? Are these the rapid test kits? Where the testing is being done and so on?
Okay, that's a great question. So wing testing, or the National Guard testing that we talked a lot about in the past, is still taking place. There was one today in Wapaka. There is one Friday in Lincoln County, or up in Merrill. We have just put in today for another wing testing, which we would like to bring back to our community. Wing testing is about 2 weeks out. The reason being is that the number of Guard troops was reduced down to 11 troops. So there's only 11 troops statewide, whereas before I think it was 26. Don't quote me on that number. But there was many more troops available. So when we were getting more wing testing, they just had more availability. So they're about 2 weeks out. We're looking at doing that again. But currently where the testing is being done is at all the local facilities, which is, of course, Ascension, Marshfield Clinic, and Aspirus. Some have drive-through clinics, some do not. The University of Wisconsin-Stevens Point is conducting its own testing as well, which is the Anagen Testing, which is the quick testing that they're doing. They are testing up to 200 students in dorms every week. Their goal is to continue to test for 200 students in the dorms on campus per week, but they're testing asymptomatic. So those are the kids that are not symptomatic. Kids with symptoms at the university are being tested at their healthcare center but that's with the PCR test. So that's the nasal swab test that they're doing. There are testing, Anagen testing, and Anagen testing machines that are going to be supplied to every long-term care facility, so nursing homes and schools. So that's the goal of the state, that they want to get the ability to do the Anagen testing there. So testing is ramping up. We ourselves are looking at trying to increase the testing capacity. And we're looking at trying to work with our local EMS with a strike team to possibly have a kind of a quasi-permanent, if you want to call a temporary shelter, quasi-permanent place where we could have drive-up testing, hopefully 2 to 3 days a week, but it would probably be like only for 3 or 4 hours a day. That we would do that. We know that the guard is only available till the end of November. And although I heard today on a call, maybe up till December 10th, and then they'll all be decommissioned and sent home. So that's where it's happening currently.
Supervisor Dubek.
After the mask mandate came out, the county set up a complaint line online to have our citizens report mask violations. How many have we gotten, and how many are legitimate, and what's the follow-up process for that?
Well, you know what? I'm going to ask Chris to do that because Chris volunteered, and thankfully volunteered to kind of handle this for us. I will tell you that we get them, and not all are legitimate. But I'll let Executive Holman answer that question.
Yeah, there was a public records request from the Journal recently, and at that time we did do a tally, and it was roughly, I think we had 63 what you might consider legitimate concerns, and then many more, especially in the early days, sort of pranks and illegitimate, just people having fun or bored at home. So in any case, those we still keep track of. They're still a record, but they wouldn't work through the enforcement process at all. And so nowadays, the traffic on that complaint form has slowed down quite a bit. The weekends still you see maybe 6 to 12 over the weekend, but during the week right now it depends. It's maybe 2 to 5 per day. And so of those, I would say that most of them, I'd say 80% to 90% are legitimate concerns in terms of people identifying a situation, identifying what happened, a location, giving their name so that we can follow up with them and the place where the concern was with an education point. And so you still get a few here or there that are, I call them the nonsensical complaints, but in any case, it's still there, it's still working, it's still providing opportunities for the conversation to take place.
Supervisor Gifford.
Yeah, on the question of hospital bed availability, I just happened to get the CAP Services Community Needs Assessment update in the giant PDF file. But according to that, on page 5, it says Portage County has 12 ICU beds, 84 staffed beds, 94 licensed beds. Waushara has 4 ICU beds, 25 staffed. Marquette has 0 ICU beds. Wapaka County 4 ICU beds, and Allegheny County has 69 ICU beds and 466 staffed beds. And the CAP area, which is those 5 counties, is not considered one where health services are overtaxed. So I guess we dodged the bullet that way.
Yeah, and there's more behind those numbers as well, in a sense that if you remember in the very early days, most of the hospitals shut down all their services and created wings. They were anticipating, a surge, the flattening of the curve, all that stuff. And as time went on, they reopened back up to 100% of their services being provided. And so I can't speak for the hospitals, but based on what they've done previously, I would assume that part of their planning is that they have the ability to pivot some of their rooms and create negative pressure, things like that, if need be. So yeah, and we're in constant communication with them. The hospitals have their own planning, their own leadership and all that, but I would say public health is probably talking to them on a daily basis and vice versa. And so that line of communication is very open. It's very helpful to hear back and forth from one another. So I think, the communities express worries about different aspects of this, and I'm just mentioning it now just to reinforce the fact that there's a tremendous amount of work and communication happening between all the different parties, and everybody's they're following these sorts of things very closely.
There's several meetings during the week that happen with groups, and one of the reasons that I always put this on as a standing agenda is for the rest of the board members to know that I know that there's Wisconsin counties, I think, has 2 every week a Monday and a Wednesday. We have one with a lot of the staff, the WEC, that is every Wednesday. There's another one that Gary hosts. How often is that one? Every other week. So there's a lot of touching base with a lot of people and a lot of constant information being shared back and forth. It doesn't always get back to you folks, so it was important that once a month that we have these folks in front of you so that you can hear some of it, and feel free to call and ask myself or Chris, and we can give you updates on any of that. But there's a lot of discussion going on out there, and UWSP, the school systems, there's representatives from all those, the hospitals, there's quite a number of people on those calls. So trust us, there's trying to keep the transparency out there, but at the same time, there's things being done, even though we don't always see it. So.
And sorry.
Go ahead, Chris. Do you have a comment, Chris?
Well, I have more information, but.
Go ahead, finish up.
Okay, sure.
Okay.
Just a few other things. I wanted to note, just on the contact tracing aspect of it, that we have had fluctuations in staffing there, because sometimes people get into the job and they realize it's not for them. Occasionally there are people who get into the job and aren't good at it, or they go to a different job. They just move on to a different position. So this filling of the ranks, it's kind of an ongoing process. We have a large pool of people that we've been drawing from, but again, as Ray mentioned, part of the difficulty is getting people who can work weekends and are up for the schedule. Also, just to tack on to the end of where the case is happening, we continually say there's community spread because people want to look for the one place or the one or two places. But the reality is that it's in the community, the virus is. So people should just assume that wherever they're going, that there's a potential that it's there. Okay, and that's not a fear thing. It's just to say that, you shouldn't set yourself up with a false sense of security if the county didn't say that this location wasn't problematic. But along those same lines, I think that while you have a lot of cases being generated by these private gatherings, and small and large, there's been gatherings of just a couple families, and the majority of those individuals test positive. So sometimes there doesn't seem to be rhyme or reason in terms of how it moves through the community. But the one thing I wanted to make sure I noted too is that, and something for you to reinforce with folks, which is just a basic principle heading into fall and winter generally, is that if you're sick, you should stay at home. If you have symptoms, you shouldn't go out in the community. You shouldn't go to work. If you can work from home, but call your medical provider if you're worried about it, because we continue to have cases where individuals think, well, maybe I just have my seasonal allergy. It ends up not being the case. They end up testing positive, but in between those 2 points in time, they generate dozens of close contacts, which then have to be quarantined, and the impact for that gets large in a hurry in terms of on businesses and on people's lives. If you follow any of the Facebook conversations, the Division of Public Health does a very good job of putting information out there. There's been questions about the hospitalization data, and coincidentally, as the increase in cases started to happen, there was also the conversation around that data point, because for a long time we only had 1 or 2 hospitalizations, and so we knew when we talked to a hospital, okay, that patient is still there. It was an easy data point to track. But as you had an increase in hospitalizations, we learned that the data point itself was inaccurate. And so the decision was to not report that data anymore because it's inaccurate data. There's people who are hospitalized outside of our region. There are people hospitalized even in a different state, for instance. And so there's a lag in that data point, and so it's harder to track in real time. But DHS does, in their reporting, have the metric of newly hospitalized, which is accurate. And so we switched to that as an accurate data point. It's not necessarily the data that everybody wants to have, but it's data we know that is accurate. And that's the important part of what we're putting out to the community. It's in line with what other counties are doing, presumably for the same reasons. But even still, we have reached out to DHS and our local healthcare partners just to say, is there a way to try to get our hands around that data point? And it's there's lots of different data being processed. Like the Division of Public Health does do a lot of it, but the hospitals do some, clinics do some, UWSP will do some. And so that's why DHS becomes like the clearinghouse for all the data. And then we pull the data off of their server every day. It's frozen in time, they say. And so that's a snapshot. And then that's what we get to report. Let's see. There's been questions around local health authority. They remain in the courts. I'm watching all those closely, as are all of my peers and your peers across the state, because the few cities and counties that have maintained a health order, whether or not they've had injunctions issued against them, they're still in state and federal court. Those conversations are going to shape a lot of the things that counties and cities are going to try to do, or in the sense of how do you even approach it? Like what's the boundaries according to the court system? Most recently, the Madison-Dane County Public Health Department, they had issued an order that was for the schools in that area. And long story short, the Supreme Court took it up and they issued a temporary ruling that issued an injunction against it, which invalidated the order for the time being. And so their temporary ruling essentially said, based on what we understand, this is from the Supreme Court, that the school's side on this case is going to prevail, and that the local health authority, the local health department does not have the authority to issue that kind of an order. The reason that one is interesting to me is that in the reporting on this, there's been some questions around the possibility of either through the courts trying to speak to certain areas of authority. They're not going to rewrite statute on their own, but there's questions about local health authority just in general. And that's been a concern just for everybody, because there's been so many questions and so much ambiguity around what counties can and cannot do, because counties have never been in this position. Normally there's a coordinated federal and state response, and we're a part of that. Absent that, now the state is essentially punted to us. And as a part of that, and through these court cases, what you're seeing is a sort of, they're putting different jurisdictions on islands. So like counties, cities, some counties have city-county joint health departments, and now schools are going to be in the same position. And the Madison-Dane County one is also interesting, because if you look into the orders that have been issued, the reason they're in the larger cities and these joint health departments is that they base them off of municipal code. And municipal codes have a clearer authority in statute under Chapter 323. It's the same reason you saw the mask or face covering orders being issued by cities and villages and a town here or there, because the municipalities had clearer authority under 323 because of constitutional home rule. This is true for many, many issues with municipalities, where they may not always have the resources to utilize that authority, but as municipalities, they have authority that cannot be preempted by the legislature. We have administrative home rule. It's not the same thing. We get preempted, as you know, all the time, but that's also not surprising because we're essentially an arm of the state. But anyway, the point is that it was interesting to me that the Supreme Court issued against them with the municipal code underlying the order. So I don't know what the implications of that will be for constitutional home rule. I'm not a lawyer. I haven't asked questions of lawyers about that yet, but this is news. I think it was 2 days ago. So, but it's something that I'll be pursuing to try to understand what happened there and why. But even still, the Supreme Court is likely not going to take that up for 2 months based on the media reports. Aside from those kind of frequently asked questions that we're getting from the community and others, there's ongoing conversations around masks, or face coverings, if you will. So we know that the face covering mandate from the governor will expire on September 28th. There's lots of different opinions out there about it. There is a court case in Polk County that was filed against it. That's kind of sitting there waiting to see what'll happen. But in some ways, there are lawyers who have expressed opinions that say, well, if the governor would have more of a leg to stand on now versus the end of July when he initiated the order because of the change in cases across the state. And, people will, there's questions about whether it's viable or whether it works or not. And I think generally the consensus and science on it is pretty clear. So I think that will play into whether or not the governor decides to extend. That said, there's another piece to it in the sense that one of the questions about his authority is whether or not he can kind of have these rolling orders, because he has a 60-day window and it's a prolonged pandemic. So this is a unique situation. So who knows, but they may also put in a gap of time so that it's not consecutive. I don't really know. These are just the questions I'm asking myself. But from when it comes to us and what we're doing, we started maybe 2 months ago by introducing Chapter 4 to the HHS board, saying here are all the updates that we need to make. To be very clear, the Chapter 4 updates would have to happen regardless of COVID-19. To be even more clear, adding a section on communicable disease is not COVID-19 specific. This would be for any communicable disease. So as this work gets completed between public health, myself, and the Corp Counsel's office, we'll certainly be talking to Chair Dubeck. And, in my opinion, I would look for a special meeting where this could just be the sole subject of discussion so that it's more focused, and then have that conversation. But again, the point I'm trying to make about the need for Chapter 4 is that people may try to interpret it as being driven by COVID-19, but it really is a question of, is the county equipped to respond to communicable disease at all? That outside of the authorities that are already more clear in some statute. And given what's happened to us now by everybody saying, hey, counties, guess what? You've never done this, now you get to. If that continues to be the case, then I think the task for you as the county board and under your authority in Chapter 59 is how does the county prepare to deal with communicable disease writ large through Chapter 252 authority that's vested in the Division of Public Health. And that will be the conversation that takes place. Because it will be a special meeting, in my opinion, I told Chair Dubeck, like, it wouldn't make sense to bring it to a regular meeting because then all the other regular business kind of gets lost in the mix. It's more important to say, here's a focus, let's talk about it and move through that.
Chris, you get to talk after this too, so save some.
No, it's okay. I'm just going to segue right into the budget while they're all really enamored with what I'm having to say. No, there's a lot going on, obviously. So I'm just trying to be, as transparent and try to cover as much as I can, because we don't want to get these snapshots in time and don't necessarily talk all the time in between meetings. So obviously, we are looking at what other counties are doing, what steps they're taking, what do the resolutions look like. Many counties haven't taken action yet, but how they're approaching this is helping our conversations a lot. Similarly, the legal guidance that you heard about at the last county board meeting, that's been very helpful from the Counties Association, and that guidance focuses exclusively on Chapter 252. And so that's helping us kind of shape our thinking around what does 252 do for us with that guidance. I already mentioned that court case, and yeah, also just so you know, the next update to Portage County's COVID-19 policy, when that happens, I will of course share it with you within the 24 hours, as I have been with all the others. That will include, I'm going to include a county specific face covering requirement as well to continue that, regardless of whatever's happening elsewhere. Lastly on this, we did that virtual town hall and it was very successful. There was probably a need to focus it a bit more, but that's what we're going to do moving forward. So we're planning another town hall where it'll be focused exclusively on contact tracers being there as a part of the conversation, explaining what they do and how they do it. Also our medical partners from the HERC, which is the Healthcare Emergency Readiness Coalition. We'll have Dr. Clark, hopefully speaking to that, and then we'll have another doctor from Ascension who can provide their perspective, as well as Bob Smith from Aspirus. So it will be much more focused, the same process where it'll be recorded, put on a dashboard, people can watch it if they can't make the time, that kind of stuff. And then also, we obviously are talking to the press a lot. We have been for many, many months. We did media briefings for some time, but the media briefings weren't always convenient for the press, weren't always convenient for us. We still recorded them, even if no one was present sometimes, and posted them because it was important to get that information up. But we're moving to more of a monthly frequently asked questions, kind of like an expanded version of what I led off with here, so that then that information can get shared with the public and people can regularly see what's being shared there. I can stop there, and then I guess budget's next.
Supervisor Johnson, you have a question?
Thanks, and I almost forgot what it was.
Sorry.
My question is, it relates to the event at Pacelli. And I was on Gary's call that happened on Tuesday, the regular biweekly call where leaders from the community attend and we talk about the various aspects of COVID. I was there on behalf of the city and, I'm county board supervisor as well. So I listened to the woman from Pacelli say, don't worry about it. We've got Panacea covered. We have a plan. We are going to make sure everyone's social distance, and we've worked out this plan with our health department, or the health division of Health and Human Services. Don't worry, everything's fine. Well, it wasn't. And so if we don't have any ramifications from, some of the very egregious violations of their own plan, what's the sense in the plan? I guess, what does public health division how do they intend to approach these in the future? And do we need to do something to beef that opportunity up? Because the plan wasn't worth the paper it was written on.
Well, I think that, so to Supervisor Johnson, that's a really good question. So, we worked with the organizers of the Panacea event. I think, and I am sure that their intentions were that when their volunteers would be wearing masks. It became apparent through some social media channels that some of the volunteers at some point were not. The point is that this was their plan. We worked with them. We said, yep, we think that, we talked about how things needed to be socially distanced, what they were going to do. Their food was going to be all catered in. They weren't going to have people cooking. They were going to do mostly curbside pickup and those type of things. All was good. The fact that individuals made a choice to not wear a mask, and again, I am not questioning, they may have had a reason. They should have shared that, obviously, with the people that were organizing the event. But, our role is that when events happen, no different than when we had the county fair several weeks ago. We worked with the fair people, earlier in the summer on other issues as well as the fair. We talked about our concerns. We talked about recommendations. The fair did what the fair wanted to do. Panacea was no different. They listened to what we had to say. In my opinion, I think they did a really good job of trying to implement it. Individuals didn't follow through. We are not in a position to where, we're responding now, and we certainly have reached out to the organizers and said, look, this is what you kind of said. This is what some of the community was thinking, and obviously it didn't happen. I know our EH, we received these yesterday. I think our environmental health EH is what that stands for. Was reaching out and trying to get a hold of them today. Again, I think that if you want to say their plan wasn't worth the paper it was written on because somebody didn't follow through, I think there was still a lot of really good things that happened there with some of the social distancing that took place, with some of the curbside pickup and things that they did. People are having these events. People are putting these events on. We're trying to work with them to make them as safe as possible. Obviously, if we said, look, the best thing is not to have any events at all, we don't control that. If they wanted to put on Panacea, that's what they were going to do. If the fair board wanted to put on the fair, that's what they were going to do. We're just trying to work with them to try to make them as safe as possible.
And thank you, Director. I appreciate that, but it wasn't just individuals coming to hang out. It was actually the volunteers who it would have been great to have them briefed. People were frying food. Yeah, it probably didn't turn out the way they wanted, and would be good if we could figure out a way to have that not happen again, because it just turns into a super spreader event. So thanks for your work.
Certainly.
Supervisor Moresi?
Thank you, Mr. Chair. Just a couple of questions. Thank you, Melissa, for asking that question. I was actually the one who asked the president of Pacelli, why they were continuing to push forward with this event at the public health call last Wednesday. She did assure everything would be, planned out as best as they could. And I understand we can't control individuals. Unfortunately, the photos that I think most of us have seen are the people who were unmasked were the bartenders, the people who were grilling out burgers and brats and things like that, and our very own police force, unfortunately. So it just bugs me that probably the most important people who are having more interaction with others were the ones who chose to be unmasked. And I do realize, again, we cannot control individuals, but I feel like we could, as an organization, really encourage other entities to not hold these events. I mean, I know it's not a popular decision.
Mr. Chair, is there a question in here, or is it a political statement?
Continue, Mr. Moresi.
Thank you. I'm sorry, Mr. Jakowski, but I'm qualifying my questions. So I'm just wondering how we can start to mitigate, other institutions or organizations and try to encourage them not to do that. That's one of my questions. That involves the fair, Panacea, the food truck festival. I saw pictures from the fair and nobody was masked in one of the exhibit halls. And it's frustrating to see that those plans not being followed through. And then my other question is, I guess at what point do we, is the amount of outbreaks we have constitute an outbreak? Like when do we call it an outbreak, and when do we, press forward with action that can help prevent this from spreading further?
Well, the way we define outbreak, Supervisor Moresi, is that if there are 2 positive cases associated with any one type of business, that's going to be labeled an outbreak. It's 2. That's a small number, we realize, but that's the definition. Unless it's a healthcare center or a long-term care facility, then it's 1. So if you have 1 positive case, they're considering that an outbreak. Definitions from the state that we certainly use, and at the end of the day, as Executive Holman alluded to earlier, it's here. We know it's here. It's around. We take and we relish the opportunity to work with organizations that want to put something on, so we can give them some guidance about how to do this safely as possible. At the end of the day, I think people are going to make decisions. I think people have said, there were not a lot of people wearing face coverings at the county fair. That could very well be true. I wasn't there. I can't tell you that with any certainty. However, they made that decision, and people have to make that choice that is good for them. And our guidance over Labor Day weekend was not just about the fair, but it was like, this is what you should do. This is how you should try to stay safe over Labor Day weekend. I would hope that people are listening to what we say, but at the end of the day, people are still going to make their choice. And that choice may or may not lead to them becoming positive or others becoming positive. Whether we like it or not, we are living in more of a reactive situation where we're just dealing with the positives as they come in, trying to do the best to educate the community as we can.
Thank you, Director Shabilsky, and I do appreciate the work you're doing and the work that Gary Garcia is doing. I think we're all frustrated and we're all still scared, and especially heading into the winter. So thank you for your continued vigilance. I appreciate it.
Thank you.
Supervisor Moore?
Thank you, Mr. Chair. Two things. First, I'm hearing all of this, but I also want to say, like, as leaders of this community, even in this group, we aren't all masked. So if we want our constituencies, our family, the residents in Portage County to follow, we also need to follow as well as leaders in this community. Second, thank you, Ray, to you and your team and the work that you've done. And I can't imagine how hard it is for you. My question is, are there, and I know maybe you might have answered this in the past, but are there any guidelines, well, not necessarily guidelines, but any like restrictions or rules that businesses have to follow once they find out that someone at the business is positive? And I'm meaning like how long do they have to inform all their employees? Can they stay open? Can they not stay open? And what kind of protection do they have? Is there any for staff who does not feel safe to go to work in protecting their jobs?
Okay, that's a good question, Supervisor Moa. So, we continue to work with local businesses in regards to, if they have an outbreak. So I'm going to say outbreak because it's 2 cases. Our guidance with them is certainly around, the cleaning that they should be doing. Obviously, if you had positive employees, people are going to be under isolation orders. Close contacts are going to be under quarantine orders. What's really going to happen and what's really driving some of these decisions is that we have to look at, and we work with the businesses, what do you have after you do the cleaning? Do you have staff to run your business is one of the first questions you have to answer. And most businesses that have had these type of outbreaks have closed for a period of time. They've gotten themselves the thorough cleaning. They've worked with us on how to do that. As far as the individuals not feeling safe about returning to work, or working in that type of environment, we don't have that jurisdiction, as a health department. We certainly can try to provide information and education, but that really unfortunately becomes, and I shouldn't say unfortunately, it's an employee-employer situation.
Supervisor Soik.
Please correct me if I'm wrong. When, how, and why did the active definition turn to 30 days?
Well, that's always been out there. So really, because people think, well, if I'm no longer in isolation, so I'm a positive case, I get put into isolation for 10 plus 1. So it's 10 days, and then it's 1 day that you have to be symptom-free without the use of any type of fever-reducing agent or anything on board. And so people say, well, they should be recovered, but the virus can actually test positive and be in your system up to 30 days. And so the state came up with that definition, that's the definition of recovered. And really, the way they originally defined it is, you have to be alive after 30 days. Yeah. That's the way they defined it.
So with this new reporting, and Chris elaborated a little bit on with what the governor and what he may or may not do on the 28th. Doesn't this skew the way that it looks? Doesn't it skew the actual numbers compared to when we first started with the reporting and the tracking and the numbers and the keeping track? This to me, and again, please correct me if I'm wrong, feels like we keep changing the objective. We keep changing where we should be at and when we should be at it. Again, so I get the how, or I get the why, but when did this change over? Because obviously in the beginning we didn't always go out to 30 days. Now, does that mean somebody's still contagious for 30 days if the virus can still be tracked, or they can still test positive? Does that mean that then they should be quarantined for 30 days? That number is a bit alarming to me. And like I said, if I'm wrong, I am here to be educated. Vinny would probably be very happy to hear that.
So that definition of recovered has actually been the state definition since May. I know that for sure. So that's the definition we've been using. Does it kind of, if you want to look from what you're saying, does it kind of look at it and skew the numbers per se? Because you're saying they're out of isolation. They are back to work, they're back to school, they're doing everything that they need to do, yet they're still not considered recovered. And so, yeah, I think if you want to look at it, that it would skew those numbers, for those additional X amount of days. But then when you get to that point, it's also the recoveries are going to start coming in at a much more rapid pace. So, our recovered percentage, has always been in that upper 80s until we saw this last big uptick. And that's to be expected because we're just getting so many positive cases or confirmed cases, if you want to look at it that way, that we're bound to see that percentage go down. But when, if, as I said earlier, if we level off, you're going to see that recovered number skyrocket. It's going to go up pretty quickly. So,
thank you.
But it's been that definition since May.
Thank you.
Yep.
Mr. Splinter.
I know when we have this reporting of no mask and people mention the Pacelli or the local bars. And I'm trying to ask this in a nonpartisan way here. In 48 hours, we're going to have 5,000-6,000 people put into a airport hangar up. Well, we have we're a stakeholder up there. What, just out of your medical guess, of 5,000 or 6,000 people, how many would you guess would be COVID active, and how many would it take to infect everybody there? I mean, obviously you don't have any jurisdiction over presidential rallies coming to our area, but it just, again, don't peg me one way or another here. It would be interesting. I'd find it interesting to go last year, but I find it like, well, I'm over 65. I don't think, but it just seems like we pick on the little small businessmen within our community, and then when the big shots come in, we kind of let them do whatever they want. I was just curious, statistically, if you had to guess,
statistically, if you look at the percentage of positive or confirmed cases, that's still pretty low. But I will tell you that we have tracked and traced one positive individual that turned into multiple positive cases, because of a social gathering. So if there's a positive individual at any gathering, there's a potential that it can spread, because the key here is not the key here is not how many positives, but the social distancing. Are they practicing that? Are they wearing some face coverings? Is it going to spread more easily, if you will, because I have a bunch of people crammed into a small space? Our guidance for a lot of folks when they ask, because we've been asked for guidance to say, well, what if we want fans at our local football game? How many people can we put in? The answer is, it's not a number, and you shouldn't look at it as a number. What you need to look at is, can you give everybody 6 feet? Unless you're a family, if you're at that cohort, you don't have to worry about that, but that should guide your number. So if you have the ability to put, 200 people in a football stadium to watch a football game because you can do this distancing, that's fine. But, if you only have the capability to put 50, then that should be your guide as well. It's not a real number. Obviously, I think there'll be concerns about that. But, we've had, and I'm going to be really honest, we've had some events in the county over the course of the summer that we were very concerned about, and we haven't learned of any positives coming from some of those events. So that's been out there too.
Anybody else have any questions or comments? Supervisor Machikowski.
Thank you, Chair. Director Shabilsky, how long does it take for the contact tracing? So let's say there's a positive case turned in, a contact tracer is assigned. How long does that process usually take before those contacts are being notified? And I realize as numbers go up, that I'm not sure it's going to take longer as your employees. If you lose one,
Yep.
You know, but do you have an average?
Yeah, sure. And that's really a good question. So, you know, really what's going to start out is that, you know, if an individual is test positive, they're going to be notified by the medical provider. So we don't do that notification. But then the next step is it comes to us. Our first contact will be with the positive case. All right. Because again, we're going to talk about isolation. We're going to talk about that. And of course, that is what drives the close contact case, you know, or the cases, because we need to ask, who were you with? You know, where were you at? You know, were you here? Were you there? Can you tell us these things? We've had, you know, and it really depends on what that looks like. And plus, I think there's other factors currently going into that. I mean, right now, you know, we've identified close contacts who've become positive. Well, when we identify that, we kind of already have a lot of that information because they were already in this case here. So honestly, you know, I mean, when we get that case, it just depends on how much the positive case knows, because they can say, well, you know, I was with Matt and Barry, but do you have contact information for Matt and Barry? Do you know their phone number? Do you know their address? And if not, now we have to spend time trying to find out where the individuals are, so we can make that contact. You know, we are, you know, right now I would say that we try to work a case, you know, with the day we pick it up, we want to work the case, the complete case. So that's the positive, that is, you know, the close contacts. But, you know, our workload, and because of some of the issues I just described, it can be out a couple of days. And sometimes we can't get a hold of people. There's lots of different reasons for that, you know, and then we wind up, we wind up getting the case, you know, from the state, you know, and it gets put into WEDS, and it's 4 to 5 days out. So the positive is already 4 to 5 days out. Well, we get to it the next day, you know, we try to work with that case, and by the time we actually, I'd get to identify some people, they could be 9-10 days in. And so, you know, I mean, you know, we hate to admit it, but there are times that you know, we're ready to send a letter of isolation, and the same day we're sending them a letter to tell them they're done, just because of the timing of some of the things that happen. So,
and one more follow-up to that question: have people been cooperative with contact tracing, or do you have that person that says, "I'm not talking to you"?
Yes, to answer your question, we've had people that, you know, I don't want to say a vast, but we've had most of the people we deal with, they've been cooperative, but there's a significant percentage of people that aren't. They don't want to deal with us. You know, we know that people have figured out, you know, if it's a county number, don't answer. Mm-hmm. And we've heard that from people saying, we're like, well, we're trying to get a hold of it. Well, they won't answer the phone. They're not going to answer the phone. So, you know, yeah, we've had some people that have just been real obstinate to this. Our job isn't to determine whether or not they're obstinate. Our job is just to do the best we can to get them the information. So,
okay. Supervisor Medine.
As a member of the Health and Human Services Board, I have continually supported the path that the County Health Director, the County Division of Health have taken over the last actually 7 months of this occurrence. I admire their objectivity through this entire process, and they have outlined that to those of us that are board members, and I've appreciated that. They've taken into consideration the cases over the 7 months of 71,000 people, which is 1.4%. They've taken into consideration the hospitalizations of the 71,000 people in this county. They've taken into consideration fatalities of the 71,000 people in this county. They've also taken into consideration most recently the risk level of the group most affected by the new cases. And so I'm very proud of the way that they have handled this. I'm proud of the way that they have the objectivity that they have shown, and I presume will continue to show. So thank you very much.
Thank you, Dave.
Supervisor Barry Jakowski.
Thank you, Ray. You talked about EMS setting up some testing, hopefully in the future here. First, I was going to question you, but for timely reasons, I'm just going to make a quick statement. I hope that we do something so we could set up appointments with that instead of drive-through. And I just to elaborate on that a little bit. I went when we were having one of the National Guard testings at the Ruth Gilfrey. Sat in the, you know, it was time, and it was at the time when we were going to, I believe, start opening things up a little bit. And I thought, well, I'm going to go get tested just to see where I'm at. And I sat in line for 2.5 hours, and by nobody's fault. I mean, it wasn't the county, it wasn't your office, wasn't the National Guard. We ran out of tests. But it was a waste of 2.5 hours because I sat there and nobody said, you know, when we run out of tests, we're going to be done. I didn't know there wasn't a infinite amount of tests. But I think if we're going to do drive-through testings instead of people sitting for an hour and then saying, oh, the guy ahead of you got the last test, if we could do something appointment-wise, or it's just a suggestion. But
no, and it's a good suggestion. I'll tell you that we've already taken that under consideration because because this will be planned and ongoing. We can work it to where you're just going to have an appointment. Come at your appointment time, because we certainly don't want people backed up for miles like they were on our wing testing. So then you need porta potties and all sorts of things like that. So
somebody should have told the National Guard that. That porta potty thing.
Yes, sir.
Okay, thank you, gentlemen. Next item. Executive Holman.
I'll be quick.
Budget update.
So kind of a COVID budget light piece to this. For the CARES Act funding, which is risk recovery here in Wisconsin, we did submit a claim for $570,000 roughly. So that was the second round. There'll be another round coming up. I think that's November 6th is the end date for that, unless it gets extended, and it might. I know the U.S. Senate has been talking about extending into next year. But just as an FYI, the claim that we submitted included wages for law enforcement, wages for health and human services and public health, obviously, wages for facilities, because they're our logistics section for PPE, ordering, inventory, distribution throughout the county. The PPE that we did purchase, masks and whatnot, additional cleaning and sanitizing supplies, IT laptops and docking stations, WebEx, Teams licensing, infrastructure for firewalls, things like that. Essentially what allowed anybody who could work mobile become mobile. And really, I joke about it saying that the county went from like 1980 to 2020 in about 3 weeks. And so there were a lot of hiccups, but it's good now, or better. But also some benefit time from law enforcement and HHS, and then of course temporary isolation housing related expenses. It did not include things for EMS, for the PPE, because they have separate funds. Like anything that was not included, they generally have their own pot of money to draw from. And then in the next claim, we've got some other things for IT improvements for the other conference rooms, so that it'll be more seamless, more user-friendly, because even though it's, people all have their opinions of whether they like it or not, I think what you ultimately end up with is, instead of one user error or user confusion, it becomes 50, and then somebody tweaks this or tweaks that, and then just compounds. But nevertheless, we've got that underway. Similarly, some other IT licensing, supply orders, some other isolation housing related expenses, and then grant reporting and other wages and supplies and equipment that'll come up between now and November 6th. So it's great that funding is there for us, for counties. So we're utilizing that and the other pots of money that are available to us. And that's obviously helpful for the budget in general. It doesn't fill all of the gaps, but it fills some of them. As far as the budget process overall, we're kind of in that mode of calculating all the data to see, is there a deficit, and if there is, how big is it? At the same time, we're waiting for information from the state on other areas, like in health and human services and others. So that work is still ongoing. All of the tools that we have are still on the table. Within the next 2.5 weeks, we'll be having a lot of lengthy conversations about what shows up in the budget presentation to you all on the 6th of October, I believe. And beyond that, the levy increase was finalized from the state. So just so you know, the allowed increase this year is $275,000. So in this era, that does not go very far. So just drawing your attention to that, because it's, that's all the extra we have in terms of levy to navigate everything that's either not covered by the federal funding or just things that have come up and we've had to adjust and pay for as due to either normal business or or our operations being affected by COVID-19. Sales tax has kind of been holding, but I think that most people are expecting that to dip down in the next phase, just because the economic recovery is kind of stagnated a bit and plateaued. So in the last report, I think we were almost exactly the same as last year, which was great. Way, way better than the initial forecast, but we do have some time left to see how the rest of the year shapes up. So however it shapes up, it'll still be better than what everybody thought in the beginning of all this. So that's a big plus. But yeah, so that's the nutshell version of budget update. Any questions?
Anybody from home? Any questions? Nope.
Thanks for listening. I know it's a long time to listen. It's a lot of information, but like I said, it's really important to get this out to you all and to the public and everybody at home.
Well, I was taking the time to talk to us.
Yeah, I was just having fun with Chris. I pick on him about that all the time, but he's right, and that's one of those items where we need to make sure we only meet once a month, and there's so much going on, and Chris and I and Ray and some of the rest of us hear it so often. To us it gets redundant after a while, but we forget that a lot of you folks don't get to hear the same information, so it is important. So I was just having fun with Chris. So. Next item. Members of the public who wish to address the county board on specific agenda items must register their request at this time with such comments subject to reasonable control of county board chair as set forth in Robert's Rule of Order. Anyone on anything other than agenda items? Okay. Confirmation of executive operations reappointments. Due to the dissolution of the Ethics Committee and the transfer of duties to the Executive Operation Committees, we need to reappoint, and if there's no objections, I'll take both of these together. Reappoint James Clark to Executive Operations Committee as a citizen member for ethics-related matters for a 2-year term expiring April 18th of 2022, as well as Perry Pasternak. Motion by Supervisor Barry Jakowski, seconded by Supervisor Larry Rakowski. Any discussion? All those in favor with aye? Aye. Aye. Opposed? Motion carries. Confirmation of executive operation appointments. Appointing Supervisor Ante to the Diversity Affairs and Inclusive Committee for a 2-year term expiring April 18th of 2022. Motion by Supervisor Barry Jakowski. Seconded by Supervisor Gussel. Discussion. All those in favor with aye? Aye. Aye. Opposed? Motion carries. Appointment of Supervisor Johnson to the Diversity Affairs and Inclusive Committee for a 2-year term expiring April 18th of 2022.
I would like to make a motion.
I have to get this on the floor first. Motion by Supervisor Laddick, seconded by Supervisor Splinter. Supervisor Neville.
I would
speak into the mic, please.
Can you hear me?
Use the mic. A little bit.
I mean, can I move the mic?
Yes. Yes, you can move. You can move the mic. That bends. Okay. There you go.
Thank you. At the Executive Operations Committee, there was a discussion about the lack of representation for the Hmong community on the Diversity and Inclusion Committee. And we have an excellent representative, Supervisor Chad Moore on our board, who would be, I think, the best representative we could get from the board to be on that committee, and who would provide representation for the large percentage of Hmong residents that we have in the community. And also at that meeting, Supervisor Johnson indicated that she would step down from that appointment. And I mean, she was not appointed yet, but that she would be glad to step down for Supervisor Moore to have that position. And that's what I would like to see take place.
So are you making a motion, Supervisor Neville?
Well, I would make a motion, but we're still discussing a motion, aren't we? I mean,
You can make an amendment. The motion is on the floor of Supervisor, to nominate Supervisor Johnson to the Diversity Committee.
so would weren't the amendment that I suppose then to, instead of Supervisor Johnson, to appoint Supervisor Moore?
Second.
Second by Supervisor Dubek. Supervisor Moore.
Thank you for making that motion, Supervisor Neville. And just wanted to speak a little bit. Initially, at the beginning, I did want to be a part of this committee. I've been doing a lot of thinking about this, and I would actually request that the appointments, as it is, that is being appointed by the Executive Ops Committee. Couple of reasons for this. Number one, at this moment in time, I am feeling like me being on this committee would be tokenizing on my end. Tokenizing me, not necessarily for my expertise as a fellow county board member, but for representation. Second of all, at the moment, this isn't about me. It's about marginalized communities and make sure that they're part of local government and have a say. I know that my participation on this committee will be met with many roadblocks and many oppositions, and I would rather not be on the committee so that the committee could thrive. I will still be supporting the committee in other ways, as I am also a community member. And I just want to make sure folks know, like, let's just let this committee proceed the way that it's appointed. I will be a part of it no matter if I was appointed or not. And I am glad that I am making folks in this very room feel uncomfortable to the point that I may not have been appointed in the first place. But I've done my job in pushing us to have hard conversations that we have not had in the past, and will continue to do so. So thank you, and let's just proceed with what has been suggested from the beginning.
Thank you, Supervisor Moore. With that, Supervisor Neville and Supervisor Dubek, would you take back your amendment?
Yes.
Yes.
We're good, Ray? Yep. Okay. Any other discussion? We have a motion and a second to nominate Supervisor Johnson to the Diversity Affairs and Inclusive Committee. If there's no further discussion, all those in favor with aye? Aye. Aye. Opposed? Motion carries. Thank you, Supervisor Moore. Number 3, appointment Supervisor Robbie to the Diversity Affairs and Inclusiveness Committee for a 2-year term expiring April 18th, 2022. Motion by Supervisor Barry Jakowski, seconded by Supervisor Don Jankowski. Any discussion? All those in favor with aye? Aye. Aye. Opposed? Motion carries. Confirmation of executive appointments, executive committees, county executive appointments, I'm sorry. I don't know if anybody is going to have any objections to us doing them all 4 at the same time.
So move, Mr. Chair.
If there's no objections, we'll take them all 4 at the same time. And I'm going to need some help with one of the names on here. So appointment of Mac Young, and can someone help me with
Mark Young and Makira.
Her name is Makira Zirazua.
Makira Zirazua, Elisa Razi, and Christopher Benny. I'll take a motion. Motion by Supervisor Don Jankowski, seconded by Supervisor Matt Jankowski. Any other discussion? All those in favor with aye? Aye. Aye. Opposed? Motion carries. Thank you. Resolutions and ordinances. Authorizing for a budget adjustment for the purpose of purchasing a new Land and Water Conservation Division LWCD vehicle.
Resolution number 28, 2020, 2022, submitted by the Land and Water Conservation, Planning and Zoning, and Finance Committees. This resolution approves the budget adjustment needed to purchase a new vehicle for the Land and Water Conservation Division. It does require a 2/3 supermajority vote.
So moved. Moved by Supervisor Zastro, seconded by Supervisor Barry Jackowski. Any other discussion? Supervisor Jackowski.
Thank you, everybody. I'll be real quick with this in the essence of time. The Land and Water Conservation has a four-wheel drive pickup that they use, of course, in their day-to-day operations. We were able to purchase the truck at a very good price back in, I believe it's a 2014. The truck has began to give them some trouble. We have, instead of making the investment in fixing the truck, because it is low mileage and in relatively good shape, it will bring good on the retail. We do put money away every budget cycle to replace that vehicle, so it's not a surprise. We have a good price through purchasing on a new vehicle. Just seemed like a good idea to the committee at the time, so please join me in supporting this.
Supervisor Robbie.
I voted no on this in committee, and not with any disrespect for your recommendation. It's just that my thought is that on our vehicles in general, our fleet of vehicles represented by county vehicles, I think we need to be conscious of being a little bit, giving a little more time and like we would our own vehicles before we overturn them. On the other hand, I haven't actually seen this vehicle. You probably have. And I certainly respect your insight and opinions on it.
I echo Supervisor Robbie. As my car is a 2013 with 95,000 miles on it, and I look at that and it's starting to get to the point where it's starting to give me trouble too. But I've got 95,000. Supervisor Matt Jackowski.
Thank you, Chair Haga. Kind of addressing both yours and Supervisor Robbie's concern. I'm chair of the Highway Committee, and we've been talking about this at the Highway Committee because, of course, we're pretty vehicle heavy over there, vehicle and equipment. We have started to look at things, and I shouldn't say we, the staff has started to look at things, and it actually pencils out for us to have a quicker turnaround on these vehicles. Instead of running these vehicles completely into the ground when they're worth nothing, we get such a discount government-wise that we're purchasing this vehicle, we're going to have a new vehicle with a warranty, and we're able to sell the other vehicle at a good price that it actually is better for our balance sheet to do some of that. There's counties out there, neighboring counties right close to us, that are getting rid of quad axle dump trucks after 1 year because they can sell them for what they buy them for. Now, there may be some questions on that. Do you eventually flood the market and have issues with that? But so there is another side of this. The Land and Water Conservation Committee and staff looked at this situation and said, hey, we're better off to wash our hands from it, get out from underneath it, while we can still get a good value for it, turn over, buy a new one. And you're probably going to start to see more of this as long as we can get these good government prices through purchasing and through cooperative agreements. We're going to maybe start seeing all of our fleets start to turn over a little quicker. So be prepared for it in the future.
I know for a fact as I look at trucks that it's unbelievable what they hold for value or they ask on the market for a used vehicle. And I know I was also at a highway conference and I had seen some pictures of some dump trucks and they both looked like they were brand new. And I asked, why would those be up for auction? And it's for the same reason, because they can trade them in 2 or 3 years and get what they paid for them, if not more, and always have a vehicle under warranty. So those are some of the examples that were given to me. Supervisor Barry Jackowski.
Mr. Chair, did you not just talk yourself in a circle?
It's not unusual. Supervisor Astro.
No, thank you. But I had one more thing.
Okay.
Just to put you a little bit at ease, one of the things that we took and staff took into consideration, that vehicle is driven by many different personalities and many different driving styles. So we thought it important to make sure that vehicle was relatively safe or completely safe, I should say. And it was just seemed like a good idea to turn that over as it started having some mechanical difficulties, but thank you.
Supervisor Zastro, you had a comment?
Yes, thank you, Mr. Chair. I believe I would support both Supervisor Chakowski's in what they both stated, and believe that to be both factual and true in what they stated, and we should go forward in this.
Thank you. Any other comments? All those in favor with aye?
Aye.
Opposed?
No.
Record show Supervisor Robbie. No.
I was gonna say, then lie.
He's staying consistent. Number 2, approving and authorizing Anthem Blue Cross Blue Shield as Portage County's health plan administrator for 2021.
Resolution number 29, 2020, 2022, submitted by the Human Resources Committee. This resolution approves and authorizes Anthem Blue Cross Blue Shield as the health plan administrator for 2021.
Motion by Supervisor Larry Rakowski, seconded by whom? Supervisor Splinter. Any other discussion? All those in favor with aye? Aye.
Aye.
Opposed? Motion carries. Number 3, making a call on the Wisconsin County's legislator for emergency funding and biennial budget increase for improved COVID-19 response for domestic abuse and violence, mental health services, and drug abuse response services for multiple local government agencies.
Resolution number 30, 2020, 2022, submitted by the Health and Human Services Board and the Public Safety Emergency Management Committee. It was not approved at Public Safety, but approved at Health and Human Services. This resolution calls on the legislator for additional funding for COVID-19 response related to domestic abuse, violence, mental health, and drug abuse services.
Motion by Supervisor Bob Gifford, seconded by Supervisor Don Jankowski. Discussion. Supervisor Bob Gifford.
Yeah, I just wanted to back up a little bit my my writing of this resolution. And in fact, the CAP Services Community Needs Assessment that I referred to earlier also touches on this on page 5. Behavioral health resources will need to be available in new, increased ways to deal with the many different stresses and traumas caused by the pandemic, especially its impact over an extended time period. Issues such as domestic abuse, elder abuse, child abuse, drug abuse, suicide, which you mentioned in your indication, and other indicators of behavioral health issues are a particular concern. And the box is checked. This applies to this community, meaning the 5 counties of CAP Services service area. So I know I've been, someone has told me that I'm suggesting that we just throw money at problems. Then my reply to that was that, no, I'm suggesting that we throw people with skills and training and education at the problems. And so that these funding increases would be for staff, for people that do these jobs and know how to do these jobs. And I even reached out to the sheriff because someone suggested that he might have the statistics, to back up just what this is saying. And he indeed confirmed that all of these instances of what they're calling behavioral issues have been spiking since the pandemic started, as well as an alarming number of drug overdose deaths in our county. So that's the reason for this. And I think that local government needs to call on the legislature much more than we've been doing to start funding the needs of our people. So that's the reason for this.
Supervisor Soik.
Just a few comments. I'm extremely pleased to see Supervisor Gifford on board with some staffing, particularly at the sheriff's department. We could use a couple more deputies there. With that being said, though, without a sunset clause on this, and this money runs out, and we bring this important staff on board that is needed, where does the money come from to continuously pay? That's my only issue here. Again, I'm extremely pleased that Supervisor Gifford is willing to share his opinion, that he believes that we do need more deputies on hand. It's something that's going to be coming in front of this board over and over again, and we need to figure out a way how to get them on staff full-time for the foreseeable future, not just the next year or two. Thank you.
So I'm trying to understand, Supervisor, so like if what you're saying is that he doesn't have, if this sunsets, that these things go away, we have to get it through the legislation first, but before it creates, but I don't know if we'll ever get a guarantee from Madison that they're going to always fund everything forever, so.
Correct.
Supervisor Moa, you have a question or comment?
Yeah, I have a comment. Thank you, Mr. Chair. I have been doing domestic violence and sexual assault advocacy work in the state of Wisconsin for over 20 years. And currently I sit on the Attorney General's sexual assault response team. And I am involved still statewide on a lot of domestic violence and sexual assault victims committees. I just want to say many times victims and survivors actually do not call. So I would love to see funding for other services that could actually support victims and survivors to actually leave safely. And we've seen during this pandemic that while everybody was safer at home, victims and survivors of domestic violence actually wasn't safer at home.
Right.
On the Hmong Family Strengthening Helpline, which is in the statewide, our calls have actually doubled. And many of them are calling for resources so that they can safely leave, not necessarily police officers. So I would be in support of this, to ask for funds to go to other services that can really truly keep victims and survivors safe, such as advocacy services and housing and that kind of stuff. Thank you.
Thank you. Supervisor Morassi.
I'll withdraw my question. It was answered. Thank you.
Thank you. Anybody else? Supervisor Ande.
I also voted against this in a committee, not because I didn't agree with the increasement of funds and the necessity for it, and not necessarily in hiring of more sheriff deputies, but psychologists, social workers, etc., that we certainly need. My concern, however, is that how do we keep these people online, and who's going to fund it when these funds disappear? And the second problem I had with that was that there wasn't a plan in place to assign amounts and or suggested amounts as to what parts of what program would we cover with it. So it's basically an open checkbook that we're not willing, well, I don't know whether we're willing or not in the future, to meet when it comes up for reconsideration. Thank you.
Supervisor Johnson.
Thank you, Mr. Chair. I too worked domestic violence. I was a client advocate for a couple of years when I was in college in 99, 2000, 2001. And I agree with Supervisor Mua's assessment that people involved in domestic violence very, very frequently, most often, do not call law enforcement. In fact, they circumvent that route very frequently. So while I think this, and I will support this, and but again, I just want to make it clear that domestic violence isn't always about law enforcement. It's about getting the right kind of resources to both the survivors and the perpetrators so that we can create a system where all can heal and become productive parts of society. So I will support this, but I was a little, I was not as supportive until I started listening to everybody else's discussion. So thank you.
Supervisor Robbie, then Supervisor Barry Jakowski.
I think at some time this board will have some robust discussion about what kind of when we put any kind of dollars for any kind of staffing. I think there's a myriad of opinions out there where that would be best spent. However, I'd have to agree with Anton and Andy. I'd be very, very concerned about accepting any kind of funding from the state that is a possibility of sunsetting due to the fact that there's nothing more detrimental to our budget than taking on additional positions that we really can't afford without being supplemented by a state, which we doubt very much would have that continue on. So I think that would be a mistake to do it that way. Thank you.
Supervisor Barry Jakowski.
Thank you, Mr. Chair, but my question has been answered.
Thank you. Supervisor Bob Gifford.
Yeah, I thought I had addressed this question at the very end where it says, "Be it further resolved that these funding increases shall remain in effect without a sunset clause." And that, unless I worded it incorrectly, that would mean that there would not be an expiration of the increased funding. And by the way, the amount of funding that we're talking about currently is $15 million. And the 50% increase I'm suggesting would be $7.5 million, about 120,000 per county. So that's not really throwing an awful lot of money at the problem. It's not going to get a whole lot of staff.
I won't get a lot of bodies, no.
One.
One other thing in here is it doesn't have any, what are your wishes, Bob, for this if this passes through this body? It doesn't have a direction. It doesn't have anything that states or talks about us forwarding it on. Is that your wishes to leave it that way, or where the county clerk, this document, if it gets passed, it goes in a drawer? It doesn't do you wish it to be passed on to our legislators? That's
Yes.
something that we need to either, Supervisor Matt Jakowski?
I'll make an amendment that a copy of this resolution, if passed, is forwarded to our state legislatures along with the governor's office and the Wisconsin Counties Association.
Second. Yeah, second by Supervisor Matt Jakowski, motion by Supervisor Matt Jakowski and a second by Supervisor Barry Jakowski to make sure that this document is forwarded on to our legislators as well as our governor.
Thank you. It's the first time I've done this, so.
And, right, in the future, else reach out, Bob, we're here to help. So, and Matt had included Wisconsin Counties Association as well, so. On the amendment, if there's no further discussion.
Sorry.
Someone have a question online?
Oh, yeah, sorry. I should have chatted in that I wanted to say something. Can we also include under, to be forwarded onto End Abuse, which is a state coalition for domestic violence and victim services, for their lobbyists and their uses as well?
Supervisor Moore, can you email something as far as an address and stuff to our county clerk after this as well? We can add that in there.
Yes, definitely.
If there's no objections from the two of you, we will add that to your motion and your second. Very good, thank you. They agreed, Supervisor Moore? So this is on the amendment to forward it on to our people in Madison and others. All those in favor with aye?
Aye.
Opposed? Opposed? Motion carries. Back to the original resolution as amended. Any other discussion? All those in favor with aye?
Aye.
Opposed? Motion carries. Number 4 I'll make sure I lose my place. Number 4, authorizing a contract amendment for the County Highway R engineering agreement with AECom Technical Services, Inc.
Resolution number 31, 2020, 2022, submitted by the Highway Committee. This resolution authorizes a contract between Portage County and AECom Technical Service, Inc. for County Highway R engineering services.
Motion by Supervisor Laddick, seconded by Supervisor Gussel. Discussion. I would just tell you that, Nathan, this is because we were awarded that $1 million towards that project. Is that correct?
Yes, this project's actually been in the planning phases for the last 10 years.
Right.
It had been postponed until we got the additional funding from the state. So we're starting to back up.
Yep. Any other questions, discussions, comments? All those in favor with aye? Aye. Opposed? Opposed? Motion carries. Number 5, adoption of the 2021-2026 Portage County Capital Improvement Plan.
Resolution number 32, 2020, 2022, submitted by the Finance Committee. This resolution adopts the 2021-2026 Capital Improvement Plan.
Motion by Supervisor Dodge, seconded by Supervisor Robbie. Discussion. One comment I wanted to make, and this was sent out to you folks separately, is number 31, the ADRC dining room floor replacement. We have in there for $50,000. That's on a building that we presently don't own, but I just want to make sure everybody's aware of that because it will come up later. So, Supervisor Barry Jakowski.
Mr. Chair, it is a working document, is what you're saying, and may be changed?
No, I believe any of it, it's written in sand. Things can move around, things can change.
Thank you, Mr. Chair.
Jenny, did you want to add something? You're looking at.
It's a plan, it's not an appropriation.
Right, it's just a plan. It's just to set things in motion and kind of earmark things that we're moving forward. But and don't get me wrong, I am in favor of the flooring being replaced in the ADRC. But I just want to put my plug in there, so make sure everybody's aware of it. So, all right, we have a motion and a second. If there's no further discussion. Are you raising your hand, Supervisor Johnson, or are you motioning?
Yeah, no, I'm trying to swat away the flies, but no, actually, I'm just, I will not be voting in support of this. I think it would have been great to have a presentation about all of the items, at least a nutshell instead of just this. This is an important investment discussion, and even though this is a working document, it's for that reason that I will be voting against it. And of course, there'll be changes, I suspect, as we move along. Thank you.
Thank you. Anybody else have any comments? All those in favor with aye? Aye. Opposed?
No.
Supervisor Johnson was the only one opposed. Was there anybody else at home that opposed?
Me.
Chai?
Yes.
Okay, we have 2 opposed. Thank you. Motion carries. Number 6, internal resolution authorizing not to exceed $2,229,000 in general obligation promissory notes from highway improvement projects pending approval at the September 14th, 2020 Finance Committee meeting.
Resolution number 33, 2020, 2022, submitted by the Finance Committee. This resolution authorizes the county to borrow by the issuance of general obligation promissory notes not to exceed $2,295,000 for funding highway improvement projects. It does require 3/4 of members elect vote.
Motion by Supervisor Larry Rakowski, seconded by Supervisor Dave Laddick. Discussion. Dave, do you want to make a comment to this one? This one or the other one? It doesn't make any difference, but
I can if you'd like me to.
Yep.
All right. This is just a housekeeping comment, and I prepared a little script because it'll be hopefully easier to understand than if I just did it off the cuff. Portage County Code of Ordinances, section 3.1.48.f provides that no resolutions, ordinances, or any other action items shall be placed on the county board meeting agenda unless first approved by the respective reviewing committee or authorized by a majority board vote. Although the Finance Committee did not approve these next two resolutions until its meeting last night, September 14th, 2020, both resolutions do relate back to a county board resolution that was approved by the Finance Committee and adopted by the county board back in March 2020. The resolution adopted in March of 2020 started the process for the approval of these general obligation promissory note resolutions that are on this evening's agenda. At the March 17th, 2020 Portage County Board of Supervisors meeting, the board adopted resolution number 220-2018-2020 that was entitled Resolution Declaring Official Intent to Reimburse Expenditures on County Highway Projects from Proceeds of Borrowing. That resolution had come from the Finance Committee, and the resolution officially declared Portage County's intent to issue bonds not expected to exceed $2,385,000 to reimburse the county for expenditures incurred for various highway improvement projects. These two resolutions, the next two before the board this evening, are simply the next steps in the process for selling these general obligation promissory notes. So again, the point is that by putting them on the agenda, it's a technical violation of that section in the ordinance because things are supposed to be approved before they go on the agenda. But there was a resolution already approved back in March that started this whole process moving forward. So that's why we went ahead and included it on the agenda.
And I believe we're going to bring this to executive ops to relook at this language to see if this is the intent of their resolution. I think it was just a play on words to the fact that everything has to go through a committee before it can get to the board. And this resolution has done that both on last night as well as the date that Dave had referenced earlier. But at the same time, I agree with that. But to say that it can't be on the agenda, I believe it should have been stated in the ordinance that it cannot be put before the body for a vote until it has been through a committee. So we will have discussions on that in executive ops going forward to see if the rest of you agree with that or not. And we're not going to get a flood of these that would come through, but it does every once in a while, and you would be surprised at how often it comes up where there's something that we have one opportunity once a month to bring things through the county board, and this creates another hurdle. This gives us an option when we know something needs to come before this body and we're watching it, but the dates don't line up, that they can still have that meeting. I can still put it on the agenda. And for some reason, if it doesn't pass at the committee, then when it shows up on the item, we say that it's been removed or pulled from the agenda, and we go on to the next item. So stay tuned, but I have we will have a discussion at executive ops on the language on this and look at a ordinance change. So Jenny, did you have something? No? Okay. Supervisor Matt Jakowski.
Mr. Chair, I do realize there's a timeliness to this issue. That's probably why it was pushed along like this. And I see no problem with what we're doing this evening. One concern I do have, though, and we always have to look at it through the public eye and our constituents' eye, the finance packet wasn't posted to the internet until Friday. That's one business day before the meeting. I think the Executive Ops Committee needs to start setting a date that these need to be out 5 business days before. I don't think that's unreasonable, especially where you have something like this where people are saying, okay, it's not there, and it's going to, and it even says in our packet, well, it's going to be on the Finance Committee, and then they go to look for the Finance Committee agenda and it's not there. You know, and we probably, maybe we don't have any public, but maybe 15 people want to look at this. We always got to kind of look at that balance and pass that smell test. So I think we need to make sure that staff and committees are doing a better job of getting agendas posted out there at least 5 days in advance for people to have the chance to look at them.
Thank you. Supervisor Astro.
I would wholeheartedly agree with Supervisor Jakowski.
Supervisor Moresi.
Thank you, Mr. Chair. I too agree with Supervisor Jakowski. I just wonder why the urgency that we, you know, even if we have the smell of potentially being in violation with our agenda, why the urgency in making it go through tonight?
Jenny.
With all the fluctuations in the market, we wanted to have the sale at the October County Board meeting prior to any elections. So we are concerned on what's going to happen with the market post an election, and this is our last opportunity to get a sale done. There was some miscommunication between myself and our financial advisor and the timing. There's a series of resolutions that need to get done. I knew October was the sale resolution. We did a reimbursement in March, but the timing of this one got missed. They sometimes get confused because we have ordinances, unlike other counties, on the timing of how to get things on agendas. Most counties have a 24-hour rule because that's the law. So sometimes they go by that. And when we don't get things that we need to get on a county board agenda so many days before, back up a committee meeting so many days before, it wasn't even in my hands till sometime last week to even get it moved forward. So, and that was by the time we realized we had a miscommunication, the dates were passed and I couldn't do anything about it. And I didn't want to lose the October sale date. And considering it's a pretty typical thing that we've been talking about for highway road projects, it wasn't a contentious project, was also the other consideration.
Thank you.
Anybody else? We have a motion and a second. All those in favor with aye? Aye. Opposed?
No. Johnson.
Thank you. Motion carries. Number 7, resolution providing for the sale not to exceed $2,295,000 general obligation promissory note series 2020A pending approval of September 14th, 2020 Finance Committee meeting.
Resolution number 34, 2020-2022, submitted by the Finance Committee. This resolution approves the sale of promissory notes not to exceed $2,295,000.
Motion by Supervisor Laddick, seconded by Supervisor Dodge. Discussion. Supervisor Johnson, did you have a question?
No. The discussion from previously probably still stands, so.
Yep. I just had a note here. It said, I didn't cross it off, said Melissa. It must have been from one of the other. So, any other discussion? We have a motion and a second. All those in favor with aye? Aye. Opposed?
No. Johnson.
Thank you. Motion, all those in favor, motion carries. Motion to adjourn. Motion by Supervisor Barry Jakowski, seconded by Supervisor Larry Rakowski. All those in favor with aye? Aye. Opposed? We're adjourned.
A video of this meeting is available for viewing on the city's website, stevenspoint.com/videos.